Hi, it's Emma from Safety Glasses Online, and you may or may not be aware that I am a practicing optometrist and have been for about 20 years, which suddenly makes me feel really old. But anyway, I just wanted to jump on quickly and go through the role of an optometrist as I see it versus what society seems to think that we exist for. Okay, so as an optometrist, society, in my understanding, thinks we're there to sell glasses or contact lenses. And to be fair, yes, we do need to sell these things to stay in practice because the cost of a consultation covered by Medicare is not enough to keep the practice running. But optometry is a 5-year degree, and we spend that whole time learning about eyes and their related issues and systemic things that can affect eyes and medications that can affect eyes and all these other things that I don't think society understands. So I thought I'd go through a normal eye check just to see, just to explain that, we're not there just to sell glasses, okay? So a standard eye test in the practice that I work in includes a visual assessment prior to, wearing your glasses or not wearing your glasses. So unaided vision. Your pressures need to be checked. Then we need to check your motility, your pupils. Then we need to check your prescription. Then we need to check, having a discussion about what, your role is, what visual distances are important to you, what hobbies you like that, we may need to help you be able to see better, that sort of stuff. And obviously a history on, what's going on in your family regarding their health and eyes and yourself. All of that sort of stuff. But we also look at your retina. Now, in some practices, we have a really wide angle camera that takes a photo that's 200 degrees, which is like having your pupils dilated. Otherwise, obviously you can have your pupils dilated, and we need to scan the whole retina to make sure that there's no pathology. Now, that could include tumors, it can include bleeding, it can include blockages of blood vessels, it can include swelling in certain areas. So there's lots of different issues that we're looking for versus just a normal healthy retina. Okay, then we also need to use the slit lamp and actually check with the microscope, which is the slit lamp. That light that's going across your eyes has varying different magnifications that enable us to see things quite large. Make sure your lens is okay. Make sure the fluid in between your retina, the lens, and then your iris and the cornea are all okay. Make sure your anterior chamber is open. So you've actually got some drainage of the fluid in your anterior chamber. And then also make sure your cornea is okay and your lids and lashes are okay because, in Queensland, BCCs and squamous cell carcinomas are fairly common. So all of these things are looked at during your normal eye test, okay? So I just really wanted to convey that if you've got any issues with your eyes, your first stop should be an optometrist, and then we will refer you where you need to go, okay? And our referrals tend to give the ophthalmologist more information so that they can triage your referral quicker and actually get you the appointment when it needs to be, okay? So rather than just, writing, they've got a sore eye, we can write, okay, they've got, some cells in their anterior chamber, they've got, this size ulcer that's this deep and, all that sort of stuff that just gives them more information because we have the tools to be able to do that and also the training, okay? Having said that, if you've got an ocular emergency, you can go straight to emergency at the hospital. Sometimes it's useful to see an optometrist if it's not, sight threatening straight away, because that way we can give the emergency departments more information. But having said that, you can just go straight to emergency if it's an ocular emergency. But yeah, just don't forget that optometrists have been trained to look at eyes, okay, and we see a lot of eyes a day, so things that aren't normal tend to stand out, okay? So wishing you a wonderful day, and I'll get off my soapbox.